So what are some non-surgical options for treatment of prolapse? So one option is to do nothing, to live with it. And while that doesn't sound wonderful, it will not usually hurt you or kill you. It is uncomfortable, and usually symptoms of prolapse would be pressure in the vagina, trouble initiating the flow of urination, trouble initiating your bowel movements, having to change position in order to empty your bladder or your bowels completely, or having to splint. And splinting is a very fancy way of saying using a finger to push either in the vagina to urinate or against the opening of the vagina to urinate or defecate. Sometimes people complain that they have to double void. That is, they go to the bathroom and they get up and walk around, and 10 minutes later they go back to the bathroom to finish emptying, or double defecate, have a bowel movement, and then go back 15 to 20 minutes. So while you can live with it, as our young, healthy women are staying younger and healthier later into life, women are less tolerant of living with these conditions. And so surgery has gone from being 1 in 10 2 decades ago to 3 out of 10 women will have surgery for it in their lifetime. And that number continues to climb. Are there other non-surgical options? There are. So there are things that can go in the vagina, and there are literally thousands in shapes and sizes, but they're called pessaries, or vaginal support devices. Poise has made one to help treat incontinence that's over the counter, that looks much like a tampon but does not dry out like a tampon, but there are medical grade ones as well. We call them pessaries. This is a pessary. A pessary, this one is one of the more commonly used ones because it's easier to put in and take out, which is important because if you're sexually active, you don't usually typically have sex with the pessary in place. The pessaries go in by folding them in half, and they fit in the vagina like a large diaphragm. And as such, they hold the bladder and the top of the vagina well. They work well for cystoceles, interceles, uterine prolapse. They may help with rectoceles, although they tend not to help them as much. A pessary can be used for a short duration or for the rest of your life. People always ask, how often do I have to clean them? It depends. If you can take them in and out yourself, once or twice a week, but some people will do it every night. They take it out at night and they put it in the morning, much like you might put your shoes on. Other people who cannot take them in and out, who are not sexually active, will see a nurse or physician to do that, usually a urogynecologist or a nurse practitioner in urogynecology. And we'll take it out in spacing intervals, stretching those intervals out as far as we can go comfortably without putting you at risk for infection or complications. The biggest issue with pessaries is that they can cause irritation to the vaginal wall. They increase your risk for yeast infections. They increase your risk for bacterial vaginosis of the vagina. None of these things are typically life-threatening or dangerous, but can be a nuisance. Other non-surgical options for incontinence or for prolapse, or less surgical options, would be things like posterior tibial nerve modulation. So the tibial nerve, which is the nerve that innervates the back of the leg going down the back of the leg to the foot, comes out of the spine very close to where the nerve that innervates the bladder is. And we've learned that by using an acupuncture needle in front of the Achilles tendon just above the ankle and stimulating it for 30 minutes, once a week for 12 weeks, and then typically once every 3 to 5 weeks thereafter, we can help urgency in about 60% of women. The advantage of that is it's a non-surgical, non-invasive, non-permanent treatment without medications for urgency. The disadvantage of that is that you need to see a physician in their office once a week for 12 weeks and then once a month or thereabouts thereafter. Another option would be a permanent neuromodulation of the bladder called InterStim. InterStim is like a pacemaker. It goes in the back, usually on one buttocks or the other, and it has a lead that sits right next to the nerve that innervates the bladder as it comes out of the spine. And using that electrical pulsing, we can help to neuromodulate or pace the bladder. It may also help with rectal incontinence or fecal incontinence. It is, however, a surgical procedure. Typically, we do a test lead in the office for 3 to 5 days and make sure that it's going to work for you, and then we plant the actual device in an operating room setting.